As an in-home caregiver, you often work one-on-one in your client's own home. That makes your skills, your judgment, and your warmth especially important. Many days, you may be the main caregiver present, and the home is your client's familiar, comforting space. Your role is personal care, safety, and dignity, always within your scope. This 2-hour course builds the dementia care skills you'll use every day in the home. Alzheimer's disease and related disorders are progressive brain diseases, not a normal part of aging. Dementia affects memory, thinking, and judgment, and Alzheimer's is its most common cause. Abilities decline gradually over time, and that decline is caused by the disease itself. So when your client struggles or acts in ways that seem out of character, remember the behavior comes from the disease, not from choice. Understanding that changes how we respond, with patience instead of blame. Knowing your client's stage helps you adjust your care. In the early stage, you'll see forgetfulness, repeating, and a need for gentle reminders. In the middle stage, there's more confusion, more help needed with daily tasks, and behaviors like wandering and sundowning. In the late stage, the client needs full assistance and may have very limited speech. Your client will keep changing, so keep reassessing and adapt your care to who they are today. In the home, it's just you and your client. So calm, patient communication sets the whole tone. Use short, simple sentences, one idea at a time. Speak slowly and warmly, and use your client's name. Ask yes or no questions that are easy to answer, and always allow plenty of time to respond. Never rush and never quiz or test your client. When you slow down and keep it simple, you make space for them to connect. As words fade, your tone, your touch, and your presence carry the message. Approach from the front, smile, and offer a gentle touch. Watch your client's body language for unmet needs and respond to the emotion behind the words. Validation means meeting your client in their reality rather than correcting them. If a client anxiously says she must get home to her mother, don't argue the facts. Gently ask about her mother, listen, and you'll often see her settle. A behavior is usually a message, a sign of an unmet need like pain, hunger, fear, or too much stimulation. So notice what happened right before. That's the trigger. In a home, common triggers are noise, clutter, a change in routine, or simple fatigue. When you meet the underlying need, the behavior usually eases on its own. And remember, your calm is contagious. Staying steady is one of the most powerful tools you have. Agitation, repetition, and sundowning are common, and they're manageable. When your client becomes upset, lower your voice, slow down, and reassure. Redirect gently toward a calming activity. For sundowning, keep evenings calm, quiet, and well lit, with a steady routine. Never argue and never force. If a moment isn't working, give your client some space, then try again a little later. Patience, not pressure, is what brings the calm back. In a private home, wandering and leaving unnoticed are real safety risks. Know whether your client is at risk of trying to leave. Keep doors secured according to the care plan and the family's wishes, and provide safe places to move along with steady supervision. If your client ever goes missing, act immediately. Search, call the family and the agency, and call 911 if needed. Never wait and see. When seconds matter, your quick action keeps them safe. Help your client do what they still can. It protects their dignity and their confidence. Cue and supervise rather than taking over. Offer simple choices so they stay part of their own day. Adapt each task to what they're able to do today, which may be different from yesterday. And always praise effort and allow extra time. Doing it with your client, not for them, is one of the kindest things you can offer. Bathing, dressing, eating, and toileting in the home call for patience and respect. Explain each step before you do it, and protect privacy and modesty throughout. At meals, reduce distractions and follow any diet or swallowing guidance. Keep bathing warm, calm, and unhurried. It's a common trigger. Offer toileting on a regular schedule and never shame. If a client resists a bath, warm the room, explain gently, offer a choice, and try again later, and it often goes smoothly. A safe home prevents most emergencies. Clear fall hazards like loose rugs, cords, and clutter, and make sure there's good lighting. Watch kitchen and stove risks, and bathroom risks too. Secure medications and follow the plan exactly. Never adjust doses yourself. Know the home's exits and its emergency plan, and know when to call 911. A few minutes of prevention each day keeps your client safer in the place they love most. In the home, you partner closely with family while staying within your role. Communicate kindly and honestly with them. Follow the care plan. When a clinical question comes up about symptoms, medications, or treatment, route it to the nurse or the agency rather than answering yourself. Know your limits and call for help whenever you need it. Working as a team with the family and the agency is how your client gets the best, safest care. Your observations protect a vulnerable client, so report them. Tell your nurse or agency promptly about condition changes, new confusion, refusing food, a fall, or an injury. And in Florida, suspected abuse, neglect, or exploitation must be reported to the Florida Abuse Hotline at 1-800-962-2873. That's 1-800-96-ABUSE. You need only a reasonable suspicion. Reporting is required by law, and good faith reports are protected. For any emergency, call 911. When in doubt, speak up. Your care lets clients live with dignity in their own homes. Understand the disease and meet your client where they are. Communicate with patience and validation. Keep the home safe and promote independence in everything you do. Report concerns without hesitation, and remember to care for yourself too. You make home a safe place. When you're ready, complete the post test to confirm your learning. This has been a Palace University training.